20%. Remember that number. 20% of patients with a blood clot in their cough have a completely normal D-dimer. 1 in 5. Now, let me tell you about a nurse who became that one. I am Dr. Ravi Chani. You are tuned to Red Flag MD. This is not a lecture. This is a reminder course. Case number 2 from the outpatient department. Red flag files. You have few minutes. Let us see how many practice-changing insights you can collect. And remember, every insight here is a red flag you can use to protect your patients and yourself. The first red flag. The patient who knows too much here is the first red flag. The patient is a healthcare worker. She says, "I know this sounds silly, but I am a nurse and I worry about clots." Listen to me carefully. When a nurse or a doctor or any healthcare worker tells you they are worried, do not dismiss them. They have seen what you have seen. They know what you know. They are not being anxious. They are being informed. Most doctors hear that and think, "Oh, she is just anxious because she is a nurse." That is a red flag. And Red Flag MD exists to make sure you never miss it. Insight 1. The test was never meant for her. Here is something most doctors get backwards. The D-dimer blood test was validated on low-risk patients, people with no risk factors, no recent travel, no birth control pills, no surgery, no cancer. But in the real world, who do we use it on? Exactly the opposite. Moderate risk patients, high risk patients, patients exactly like this nurse. Here is another red flag for today. A doctor who orders a D-dimer on a high-risk patient and then trusts a normal result has just made a dangerous mistake. That test was never designed for that patient. At Red Flag MD, we call this false confidence, not safety, false confidence. The second red flag, the normal test that feels too good. Here is the second red flag. The doctor looked at the normal D-dimer and felt relief. He stopped thinking. Let me ask you something. Have you ever felt that wave of relief when a test comes back normal? Of course you have. We all have. But here is what Red Flag MD has taught me. Any normal test that makes you feel completely relieved in a patient with risk factors is actually a warning sign. Ask yourself, did I miss something? Did I order the right test? Is this test reliable in this patient? If you cannot answer those questions, you are not done. And that is a red flag. Insight 2. Why the test stayed normal. The nurse had a clot in her cough. Small, distal, not yet broken down. Here is the science. The D-dimer test measures clot breakdown. No breakdown, no elevation. The clot was there, but the test could not see it. So here is your red flag. A patient with unilateral cough pain who has risk factors like recent travel or birth control pills needs an ultrasound, not just a blood test. Remember this from Red Flag MD. A normal D-dimer does not mean no clot. It means no clot breakdown. Those are two completely different things. The patient's perspective, what she felt, what she said, what she hid. Now, let me take you inside her mind, because this is where the real tragedy lives. She is a nurse. She has worked in a hospital for 18 years. She has seen pulmonary emboli, blood clots in the lungs, kill patients in the intensive care unit. She knows what a deep vein thrombosis looks like. She knows what a pulmonary embolism does. So when she felt that dull ache in her cough, her brain went to one place: clot. But here is what happened when she sat in the examination room. The doctor was busy. The clinic was crowded. She did not want to be that patient. You know the one. The patient who comes in with a printout from the internet. The patient who says, "I read somewhere, I think I have this rare disease." The patient who doctors talk about in the break room. She did not want to be that person. So she softened her language. She said, "I know this sounds silly." She said, "I am probably overreacting." She apologized for advocating for herself. The doctor ordered the test. It came back normal. He said, "See, no clot." She felt relief. But underneath the relief, there was a whisper, a small voice that said, "The test misses 20% of calf clots." She knew that statistic. She had read the studies. but she looked at the doctor, confident, busy, ready to move to the next patient, and she thought, maybe I am wrong. Maybe I am being that difficult patient. Maybe I should just trust him. So she thanked him. She walked out. She went home. 3 days later, she woke up, gasping for air. Her husband found her on the bathroom floor. The clot had traveled from her calf to her lungs. Here is a red flag that Red Flag MD wants you to carry with you. When a patient apologizes for advocating for themselves, the system has already failed them. The reassurance trap is not just about doctors. It is about patients who know better, but stay silent because they do not want to be difficult. The third red flag, the dismissed symptom. Here is the third red flag. The doctor told her, probably just a muscle strain. He reframed her symptom as benign. Let me tell you something. Anytime a doctor says probably in a patient with risk factors, stop. Probably is not evidence. Probably is a guess. And a guess is not the standard of care. Here are 5 symptoms that should never be dismissed with probably. 1. Unilateral calf pain. 2. Unexplained shortness of breath. 3. Pleuritic chest pain, pain that worsens with breathing. 4. Unilateral leg swelling. 5. New onset tachycardia, a fast heart rate. The nurse had 3 of these, and still she was sent home. If that is not a red flag, I do not know what is. Insight 3. The reassurance trap. Healthcare edition. Here is where it gets painful. The nurse knew the red flags. She said them out loud. She told the doctor about her travel, her birth control pills, her worry. But she also knew something else. She knew that doctors get irritated by difficult patients. She did not want to be that person, so she trusted him. At Red Flag MD, we see this pattern again and again. When a patient stops advocating for themselves because they are afraid of being difficult, the system has failed. That is not patient compliance. That is patient fear. So here is your red flag. When a healthcare worker is your patient and they tell you they are worried, do not dismiss them. They are not being anxious. They are being informed. Insight 4. The 4 scenarios. 1 sentence each. Let me give you 4 situations where D-dimer lies. Each one is a red flag, and each one could save a life. First, calf clots, too small to register. If the patient has calf pain and risk factors, ultrasound is the answer, not a blood test. Second, small clots in the lungs. The study in JAMA Network Open said 12% of these patients had normal D-dimer. If the patient has pleuritic chest pain and risk factors, do not trust a normal D-dimer. Third, pregnancy and postpartum. D-dimer is naturally high, so a normal result is actually abnormal. If a pregnant or postpartum patient has symptoms, go straight to imaging. Do not order a D-dimer at all. Fourth, patients on blood thinners. The medicine stops breakdown, so the test stays normal, even when a new clot forms. If a patient on blood thinners has new symptoms, imaging is required, regardless of D-dimer. Remember what Red Flag MD teaches us. D-dimer is not a truth teller, it is a clue, and clues need context. The 8th red flag, the silent clot. Here is the 8th red flag. The nurse had no swelling, no redness, no warmth, just a dull ache. Doctors are taught to look for swelling, redness, and warmth. But in calf clots, those signs are often absent, especially in the first few days. The only symptom may be a dull ache. If you wait for swelling and redness, you will miss the clot. The red flag is the persistent nagging pain in a patient with risk factors, nothing more. And that is a lesson from Red Flag MD. Insight 5, the legal lens, 1 paragraph. Here is how the lawyer will destroy this case in court. The patient was a nurse. She told you she had a clot. She had 3 red flags: calf pain, recent travel, birth control pills. You ordered the wrong test. You trusted a normal result. You did not do an ultrasound. You did not safety net, and she nearly died. Here is your red flag. Any case that goes to court will have a moment where the lawyer says, and the doctor did not follow the guidelines. The 2020 European Society of Cardiology guidelines explicitly state clinical suspicion should override a normal D-dimer. The court does not care that the test was normal. They care that you stopped thinking when you saw the number. That is what Red Flag MD is all about. Keeping you thinking. Insight 6. The documentation that saves you. Here is what you write, not just D-dimer normal, but this. Well score calculated, moderate risk. D-dimer normal, but in moderate risk patients, negative predictive value is insufficient to exclude clot, per European Society of Cardiology guidelines. Plan, ultrasound. Safety netting provided. If your documentation does not mention pre-test probability, you are vulnerable. If it does not mention the limitations of the test, you are vulnerable. If it does not mention safety netting, you are vulnerable. That paragraph is not paperwork. It is your shield. And Red Flag MD is here to remind you to use it. The red flags you carry home. Let me list the red flags one more time so you remember them. 1. The healthcare worker who tells you they are worried. 2. The normal test. That feels too good. 3. The word probably in a patient with risk factors. 4. Calf pain with risk factors. Ultrasound, not just blood test. 5. Pleuritic chest pain with risk factors. Do not trust normal D-dimer. 6. Pregnancy or postpartum symptoms. Go straight to imaging. 7. Patients on blood thinners with new symptoms. Imaging required. 8. The silent clot. No swelling, no redness, just a dull ache. 9. Stopping thinking after a normal test. 10. Poor documentation. And one more. The most important one. 11. The patient who apologizes for advocating for themselves. She was a nurse. She knew the red flags. She said them out loud. She apologized for saying them. And still, she almost died. The test was not wrong. The interpretation was 20%. Remember that number. This is Dr. Ravi Chani. You have been tuned to Red Flag MD. I will see you in the next Red Flags reminder course. Take care.